So, do veterinary staff still need to kill healthy cats and kittens for population control? And before I go further, I think it's really vital that we're clear on definitions. So, non-domestic or feral cats are those that get no food or support from humans. And that's the recommended definition from the RSPCA and what I would recommend too. And of course, an animal management officer who's just caught a cat has no idea what it just ate. But if they caught it more than 2 to 3 kilometres from the nearest human habitation, then there's a high probability that that's cat's feral. That's not what animal management officers are catching. What they're catching are domestic cats, owned, semi-owned and unowned cats that are wandering or causing a nuisance. And those cats get food intentionally, most often, or unintentionally, from, say, a food bin, from humans. And they're found in urban and peri-urban areas, as well as around farm buildings. So, how big's the problem? Well, you need to know your data. And this is data from 2018-19, so just before COVID. And Diana Chu is reporting this for her MPhil. And so these are the intakes by state from the most populous eastern states. And you can see that there's quite a variation between intake. And that difference is as a result of how local governments manage cats. So in New South Wales, a lot of the local governments do nothing. They just say, take it to the RSPCA. In Victoria and in Queensland, most local governments will provide trap cages for people who've found a cat or have nuisance cat issues. And many of the councils have contractual agreements with animal welfare agencies to take the cats. In South Australia, they also provide trap cages, but they just say, take it to the AWL, the RSPCA, or to a veterinarian, but the councils aren't paying anything towards it. So if you're practicing in South Australia, you'll be seeing some of these cats. As you can see, there's quite a difference in reclaim rate, and the low reclaim rate in New South Wales is a result of that you have to pay $51 for to register the cat initially. If it's over 4 months of age, it's another $86, even though you didn't acquire it until over 4 months of age. And so what veterinarians are being asked to do is to desex the cats, but not microchip them, because it's a state microchip base, and the local government authorities can follow up people who haven't paid the registration. And you can see there's a difference in rehome rate as well, but that leads to euthanasia rates, which vary from 39% in New South Wales and 26% or 21% in Queensland. And really, for a first world country to be euthanizing even 21%, 1 in 5 cats that are coming into a shelter and pound, most of which are healthy and treatable, is really not acceptable. But 39% is just appalling. And I guess, how many people here have been working in a shelter, either as a student or in a practice where you've had to go and euthanize healthy cats and kittens? And how many people have been working in a practice that's euthanizing cats for councils? Yeah, so it's pretty appalling. So these are the statistics. This is the euthanasia rate, again from the same data from Diana Chu's data, of euthanasia rates of cats coming into councils and then being managed by councils, so not under a contract with the welfare agency. And the only thing I can say about that is, for heaven's sake, don't give councils discounts. I'm hearing rates of $19, $17 to euthanize a cat, because it provides absolutely no financial incentive for the council to invest in stopping kittens being born. So you'll be continuing to kill them. And of course, it's not just the animals. And this is a quote from someone working in an RSPCA who wasn't a veterinarian. The effect on mental health is a very real problem, and veterinarians were the most affected. It was terrible to see the impact on them. And I've seen so many people's lives damaged by having to kill a never-ending stream of kittens and cats. And that was by a veterinarian who used to work at RSPCA. So what can we do? Well, what are our management options? One is to do nothing, which a lot of the New South Wales councils do, or some in Western Australia. Or we can provide an impoundment service and accept stray cats from the public and provide traps for complainants. And we're killing about 5 to 10% of the urban stray cat population annually. In a city of 200,000, there's approximately 4,000 female cats producing an average of 5 kittens a year. So it's 20,000 kittens. Now, most of those, 75%, will die before they're 6 months of age. But it means that the same number or even more cats and kittens are present the next year. In Australian data, one from a rubbish tip, another in forests, one of the other sites was in forest, shows that low-level killing, so that was 30% per annum, resulted in a rapid increase in cat numbers by 2 to 3 times in those sites. And that was because of migration of juveniles and better survival of juveniles as well. So essentially, we're doing what a farmer would do, harvesting juveniles and leaving a sustainable cat population there to reproduce. So it's essentially sustainably farming cats. And I guess you've all heard this quote, insanity is doing the same thing over and over again and expecting different results. And, if you don't believe it, this is data from cats coming into New South Wales pounds or into New South Wales local government. Over 7 years, they impounded 173,000 cats and kittens, killed 107,000 of them. Did it make any difference to intake? It's 24,000 at the start, 24,000 at the end. Now, a lot of the ecologists are arguing we should go high intensity, trap, adopt and kill, but we can't adopt what's coming in currently. So essentially it will result in high intensity killing. And that is, in modelling studies, been postulated to be effective if you kill 30 to 50% of the population every 6 months for more than 10 years. So in that city of 200,000, you'd need to trap and kill approximately 4,000 cats in the first year, which would cost you between $1 and $2 million, considering each cat costs between $250 to $500 to trap, and then to hold it for the minimum holding period and then euthanize it. You'd also need a budget to build more shelters to hold the cats for the minimum holding period, which can be anywhere between about 3 days and 8 days. And so the question is there a budget or is there community support for this sort of cat management? And tellingly, there's been no reports from cities or suburbs, at the city or suburb level, from a Western country where this has been implemented or been successful. And you'll recognise this is a kitten being killed, and they don't just lie quietly, they squirm and they mew. Most of what's coming into shelters and pounds a stray, most are healthy, many are kittens. What's been killed are predominantly pre-weaned kittens and timid adults. And they come mostly from low socioeconomically disadvantaged suburbs. So, what can we do? Well, stopping the kittens would be good. So the third option is high-intensity free desexing programs targeted to locations of highest cat intake into the shelters, euthanasia or complaint calls. For all cats in the area, owned, semi-owned and unowned, and these are going to be low socioeconomic areas. We call that a community cat program, and it is a sustainable solution and it is supported by the community. And so I've got some results for you of the Australian Community Cat Program. In the city of Ipswich, we've shown that in the pilot suburb, which I'll show you more data for, we reduced intake by 50% and euthanasia by more than 80% after the first year. In Victoria, in the city of Banyule, they reduced impoundments by 67% and euthanasia by 76% over 3 years. And New South Wales, in the city of Canterbury Bankstown, in their pilot suburb, they showed a decrease of 31% after the first year. And so this is data. I'll talk to you a little bit about the Queensland site because that's where we've got most of the research. And if you remember, the average intake into shelters and pounds across Queensland was 7 cats per 1,000 residents. Now, Ipswich is lower socioeconomic than the average, and also they lend out trap cages to complainants. So they've got 15 cats, more than double the average. And we started in this pilot, the pilot project in this town, Rosewood, which had 25 cats per 1,000 residents coming into the shelter for a population of just under 3,000. And it's a really typical of a country town, and a lot of country towns have cat problems, in fact, most of them, because they're lower socioeconomic. And this one is surrounded by farmland, so quite an urban area, and then surrounded by farmland. Then after doing the pilot one, we've moved into Goodna and Redbank Plains, so 10 times the human population. Again, high cat intake, 21 and 25 cats. But these suburbs are really part of the western sprawl of relatively high density housing suburbs in the western sprawl from Brisbane. So we did letterbox drops, done a lot of Facebook posts, free desexing, stray and owned cats, eligible suburbs only. And we're very lucky that Bridget Bardot is funding the desexing at €30 a cat, which is about $46.70. Microchipping, Central Animal Records is paying for the registration, and we're very grateful to MSD Animal Health for providing free vaccinations, worming and flea and tick control. So it's just fantastic. We've got that support, and there's a QR code that people can go on. We're using Book It, and they reserve a spot, and then we qualify that they are eligible. So this is the non-target suburbs, and it's broken up by 6 months. So they did have NDN and Operation Wanted, which is an RSPCA program where they get 20% off for 3 months of the year and desex about 300 cats in that. Night drop box was closed here, which is, night drop boxes are terrible things because you don't know where the cats have come from and you can't help people to manage the problems. The shelter was closed for nearly 3 months because of COVID, but because, or the pound was closed because the RSPCA shelter, which had the contract at the time, was very close, that it really didn't make a big difference to intake. And In the target areas, we started desexing here, and you can see that actually in the non-target areas, the intake's increasing over that time. So here's the target area, Rosewood town of less than 3,000. This the dotted lines are desexing, and we desex 24 cats per 1,000 residents in the first 6 months, and then another 7 cats to make a total of 33 cats desexed in the first 6 months. The shelter was closed here. Again, the pound, and it did make a difference because these people are about an hour's drive from the RSPCA shelter. And euthanasia, you can see that intake dropped rapidly, and if you calculate it over the 12-month period from when we first started the desexing, it resulted in a 50% decrease in intake and a more than 80% reduction in euthanasia. And if you just remember the shape of that graph with the desexing and the decrease in intake, and this is a similar one from Gainesville, Florida. Again, the dotted line are the numbers of desexed cats they did an intensive one over 2 years, and they desexed 60 cats per 1,000 residents. And you can see how quickly that shelter intake decreased and then euthanasia decreased compared to the non-target area. So that intake was 3.5 times higher in the non-target area and euthanasia 17.5 times higher. So surprise, surprise, it works in Australia similar to how it does in North America. And then I was talking with the animal management officer from Banyule, and she did have a non-targeted desexing program, or a low intensity desexing program. And she was saying that they're still getting complaints about found cats and nuisance complaints. So what I did was I took all the suburbs from Banyule, and there's about 20 of them, and sorted them by the CFIA rank, the rank of advantage and disadvantage. And any suburb that's less than 1,000 is low socioeconomic. If they're less than 900, they're very low socioeconomic. So these 3 suburbs had a lot of social housing in them, and they had the highest cat-related calls and impounds. And you can see in some cases it was 10 times higher than some of the higher socioeconomic suburbs. So she started a targeted campaign to, and this was the baseline here, and targeted desexing, where going door knocking, dropping flyers, where those cat-related calls were coming from. And you can see during the first year of intensive desexing, she'd already dropped the intake, and it continued to drop from 4 cats per 1,000 residents, and note that the average for Victoria is 7, down to 1.2, and euthanasia was also dropped to 1/4. Then in New South Wales, the RSPCA approached the city of Canterbury Bankstown, which is a big city, 350,000 people. The RSPCA shelter is here at Yagoona, and they receive about 5,500 cats and kittens each year into that shelter, of which 70% are stray, 22% owner surrenders, and over 2,000 cats and kittens of that 5.5 were coming from the Canterbury Bankstown area. 75% were under 6 months of age, and they'd had a subsidised desexing program where people paid, I think it was about $35. But it was low intensity, and people had to have a benefits card. And their intake into that Canterbury Bankstown area had been constant for over 5 years, despite that program. So we looked at the suburbs and looked where the complaint calls were coming from, and decided, where we had a budget, or where they had a budget to, and logistically it was possible to start. So they picked Greenacre. And what we've learnt from the program, and from the one at Banyule as well, that micro-targeting is more effective than just a scattergun approach in the target suburb. So micro-targeting within the target suburb. So these orange dots are all stray cats coming into the shelter, and the red dots were owner surrenders. So what they went down and they door knocked here, found the feeder, encouraged them, gave them flyers, free desexing. And they desect 7 cats per 1,000 residents, which so it's micro-targeted here, which is quite a bit fewer than what we did. Only 50% of those cats were linked to people on benefits, so you can see that requiring people to have a benefits card excludes about half the cats. And they showed that intake decreased by 31% over 12 months. And so these are the preceding years, and the yellow are kittens and the orange are adults. So you can see that it selectively reduced kittens over adults. They did micro-target to where there were problem areas in Canterbury, Bankstown, but with a lower budget, only 1.1 cat per 1,000 residents were desexed, and the intake decreased by 15%. Whereas their shelter intake increased by 7% when they excluded Canterbury Bankstown from the data. And they calculated that they'd saved over $100,000 in sheltering costs by reducing the number of cats that came in. And this data is from the US, and they found that the annual family income was the strongest predictor of whether cats in the household were desexed. And what I think a lot of people in Australia don't realise, that 1 in 5 households in Australia, which is an average of 2.4 people, live on less than $650 a week. In disadvantaged suburbs, it's more households that are living on less than $650 a week. But as you know, it costs more than $300 to desex and microchip a female cat, and they're caring for an average of 1 to 2 cats. So it's, for a lot of these people, they just can't afford to have them desexed. So what else, besides stopping the kittens, and we're showing that these programs work and they're cost effective for councils, we can do to reduce the euthanasia? Well, we need to stop the timid and shy cats, and certainly by the desexing program, that will help stop kittens being born, wandering off, finding someone to care for them. But what I'd like to talk to you about is semi-owners. Now, semi-owners are people who feed a cat who don't perceive they own it, largely because the cat in most situations just appeared on their property. It's a stray cat. Or they moved into a rental property and the cat sort of came with it. Most of them are only feeding 1 to 2 cats. There are about 1 in 25 people, based on our research, who are semi-owners are actually feeding 6 or more cats. With those ones that are feeding a lot of cats, there's sometimes squalor situations and mental health issues. Most people want help and respond very well, provided the cat's not killed. And if they're only feeding 1 to 3 cats, they will take ownership in most situations if you offer them free desexing and registration. And they're allowed to have up to 3 cats. Some of them can only have 2 cats because of the local bylaws. Luckily, most are on private property, some around social housing. There are other sites like aged care facilities, hospitals, schools, shops and universities where multiple cats are being fed. And you can desex those legally, provided someone will take ownership of them. And fewer on public land, which is lucky. And based on our research, true hoarding is very rare. That's the rescue hoarder who believes only they can save the cats, or the exploitive hoarder who really has severe mental health issues. But for those people, their cats don't come into the shelter unless they're raided by a welfare officer or a local government officer. And based on our research, those people feeding 1 or 2 cats or multiple cats talk to the cats multiple times a day. They say they're very attached to the cats. They agree that the cat is a reason for getting up in the morning. They say the cat helps them through tough times, and that feeding this cat makes me feel good. This is Sarah Zito's research. It's the right thing to do, and the people who I care about would approve. And so semi-owners represent a significant avenue to rehome these cats. And the ones that they're rehoming are usually timid, shy cats that are most at risk of euthanasia in shelters and pounds. And so you're making it easy for these people to adopt them will reduce unnecessary euthanasia of healthy young cats that are very timid and shy. And it's lower cost than for shelters and pounds to take them in, hold them for the minimum holding period, euthanize, or try and socialise. So you've got to remove the barriers. You've got to make it free desexing for the semi-owners, free microchipping, free registration. And what I alluded to, well, in New South Wales, you have to pay a registration fee of $56. And if the cat's over 4 months of age, it's another $81, regardless of whether you had acquired the cat before that. Don't have mandatory containment. Remember, these cats are poorly socialised and not house trained, but over time they can be. But if you put that up, encourage and show people how they can do nighttime feeding to start the trained cat to come inside. And I just wanted to share with you this testimonial that we got when we asked for testimonials from people who'd enrolled a cat in the program. And he said, a little over a year ago, a stray feral kitten came to our home. After we realised it was going to stay, we evaluated our options as far as desexing. Due to the costs involved, we were reluctant to have the operation, as we felt the kitten could just run away just as easily as it had arrived. We then found out about the cat desexing program and went ahead with this. We were very happy with the service we received. It was very professional. And as a side, our little Fifi went in for her female operation, and when we picked her up, we were informed that Fifi was a young man. We decided to keep the name anyway. He stayed with us, and we have built a cat enclosure for him. He's a lovely, very affectionate little cat. The desexing program was great for us. Richard. This is Fifi. So you can see just giving these people a leg up can really make a huge difference to the outcome for that cat and for people in shelters. And just remember that without community cat programs, someone has to kill the cats and kittens. That's veterinarians. And killing healthy animals damages people's lives. And in some cases, killing animals kills people too. And the suicide rate for the animal rescue sector, which includes veterinarians in the USA, has reached #1, along with other emergency responders, police, and firemen. So, do you prefer this reactive approach or a proactive approach to cat management? And I really like this quote. Do the best you can until you know better. Then, when you know better, do better. So it's time. Let's manage cats scientifically and humanely, so veterinary staff do not need to kill healthy cats and kittens for population control. So thank you. I'll just put up our sponsors. There are some veterinarians here sitting in the room that are contributing to this program, and I thank all the funders who are helping this program. And I'm happy to take questions. Thank you.